will speak about what are the main symptoms, what we need to look around when we have a family member or a friend with some symptoms. So usually when we think about Parkinson, we think someone that shakes. And the shaking usually happen when people are resting. So when they watch TV, maybe the partner start to notice the people shake, but the tremor disappear when people hold a cup of tea or they do their jobs and stuff. However, there are also people that have the condition, they don't shake. The main symptoms are slowness, they notice they need more time to wash themselves, to dress themselves, or they feel stiff. So when they walk, they feel that the arm are quite stuck, let's say, stuck when they walk. Indeed, some people start to come to clinic when they have what we call a frozen shoulder. So they feel so stiff that they started to develop a pain in the shoulder. Balance can also be involved, and we call freezing of gait when people describe us to feel stuck, frozen on the floor for a few seconds, and then they need to count like in mind, like up to 10 is like a strategy to unlock themselves and start to walk. Usually one side is involved, and then the disease can spread on the second side. However, it's not just the motor symptoms. Some people, they don't have motor symptoms at the beginning. For example, even 10, 15 years before developing tremor or developing stiffness, people start to notice they don't have a very good sense of smell, or they feeling low. They feeling low, for example, not depressed. They notice they feeling sad for things, even for small things. Just because the brain starts to work in a different way, they can feel very anxious and worried, even if there are not specific reasons for this, and they feel tired, very, very tired, even doing small activities. And another thing is that people start to dream a lot. So a family member can be noticed because they speak in the sleep, they shout in the sleep, just because it's part of the condition. And later on, people can have like a sensation of feeling someone behind, like a shadow, but there is nobody in the room, for example, or seeing little animals like little dog and cat around, like hallucination, but there are no animals really there. And sometimes memory difficulties. Of course, it depends at what age the condition starts, because we usually divide in clinic young onset and later onset. So if the symptoms start before 55, for example, we call young onset, and then we have different strategies to treat them. So this is just to show you how many different symptoms, because usually, commonly we think is a shaking. When we see someone shaking, we think it's Parkinson, but can be many other things also there. Pain is also one of the first symptoms. Can you imagine? We think about the shaking, and then the first symptom was studied in Parkinson was the pain. People start to be very painful joints, muscle pain, because the muscle become rigid, and so sometimes they are in agony. So we start the pain management for that. I will leave also my slides for you, so Aisha can spread if people want to read more. What we notice in COVID pandemic in this study, so the non-motor symptoms increase also a lot, but also the condition. We saw more referral we got in the hospital, because people were stuck at home, they couldn't go out, they couldn't do exercise, and this lack of mobility brought up lots of symptoms. I was thinking that was important to mention this, because look after our health means also do exercise and do things to keep well. This can really help to slow down the severity of the disease. So how do we do the diagnosis? So when a person comes in clinic, we ask the history, we ask if there are similar people with similar symptoms in the family, if there are genetic form that can run in the family. clinical examination and the clinical experience. So it's important. If I think myself 15 years ago when I started to work in the neurology field, of course I was not experienced as now. So now I can pick it up, even a small thing or description or small episode that before maybe I was not good to. And then we judge a different type of Parkinson on the base of the progression. There are forms that progress a bit quicker, forms that involve the memory more than the movements, and we do investigation. So what are other Parkinsonian syndromes? So we have a Parkinson disease, this is the most common, and then we have another form of Parkinsonian syndrome that I listed here. Because there are, for example, some drug that has been used probably in the past that causes slowness, rigidity. We call drug-induced Parkinsonism. We have a Lewy body disease where people have more hallucination and cognitive problem. And then other form where, for example, blood pressure is not very well controlled. This helps the clinician to direct the person to the right pathway for therapies. So this is just to say there are different types of forms. It's not just one.
Sorry, can we ask questions as we go along?
Yeah. Please feel free.
The previous slide where
Yeah.
you said there's different
Sorry.
types of Parkinsonism. How do you differentiate between the different ones through a DAT scan or?
Yeah. So the DAT scan, we don't, indeed I brought here just to show here, I will go back. So this is kind of a DAT scan. This is the scan that you were mentioning. We do and show some changes in the brain because a radiologist can make some measure. We don't do to everyone nowadays. If someone has a typical symptom, so we don't do to everyone. We do only if there is any doubt. To differentiate Parkinson's disease to Parkinsonism, usually so in Parkinson we have a first motor symptom and then the cognitive involvement, for example. Whereas in the other form, like the first two, the progressive supranuclear palsy and the multisystem atrophy, for example, the blood pressure is involved sooner, so drop of blood pressure, people start to have dizziness, they can have collapse. Also changes in the posture. People start to lean more faster in the disease progression. So the posture and balance problem, they start before. Whereas in the Lewy body disease, is the hallucination and cognitive difficulty. So there are some red flags that can help us to differentiate. And above all, two things. The disease progression is faster in Parkinsonism than in Parkinson. So when we observe a person, because we see regularly people, then we see they decline a bit faster than in Parkinson's disease.
Okay, and what about, can you say a little bit extra about the drug-induced Parkinson?
Yeah.
Which drugs?
Usually some drugs that we need to use in some mental health condition, like antipsychotics. In the past also a medication for anti-sickness that was blocking some receptor in the brain that now we don't use much anymore. No, the chemotherapy, no. It's just medication that act on some receptor in the brain, but not chemo. It's more medication used for bipolar disorder, depression, or anxiety. Yes?
So one is Parkinson and the other is
Parkinsonism, yeah. We divide Parkinsonism all together is this group. Of,
Is it called Parkinson? Or is it
no, we call Parkinsonian syndrome all together, and then we have a Parkinson disease, and Parkinsonism is all the other diseases that are not Parkinson. Sorry, not to be clear.
I'd just like to ask...
I'm so happy to see you here anyway. I know her.
But a very good question would be, at what point do you differentiate between the Parkinson's and Parkinsonian? Does it take time, a few years?
Yeah.
You start to monitor and just see which way it's going?
Yeah, good question. So yes, time is very important. Also because not everyone arrives to the doctor at the same time. Some people first reach the GP after the first few symptoms and they are referred to the neurologist. Otherwise, there can be a few years before they decide, because they are worried, they have a fear to have a condition, to go to the GP and then to a neurologist. So time is very important and to monitor. Yeah. Because we usually try on the basal waiting list to see people every 6-8 months. So let's say in the first 2-3 years from the onset of the symptoms, we can differentiate.
And usually people tend to sort of go to a medical professional when the motor symptoms
Exactly.
when really it's been going on for years.
Exactly. Thank you for pointing out this. Yes. So as I say, some people start to go only when they started to notice shaking or feeling very slow or feeling the posture changing in this way. Whereas, as we mentioned, things started years and years before, but people do not know, they don't care, but they don't put attention. Maybe do not connect to something important to look after. Yeah. And so what causes Parkinson? We don't know yet all the cause, but we know what happened in the brain. So there are some part of the brain, very deep in our brain, called basal ganglia is the name, where some cells start to die slowly. What triggered this? We really don't know yet. There are lots of theories, genetic theories, also lots of studies on environment. For example, in a small village close to my hometown, there was a high increase of diagnosis because there was some kind of chemical agent in the area that could affect the degeneration of the brain. This has been studied in different parts of the world, also the environmental stuff. And so when this cell died, then all the communication across different areas of the brain become abnormal. This is why people have also motor and non-motor symptoms. So this is the scan that I show. And so what is important to do if you or a family member have these symptoms? So of course, going to the GP, but also ask for a movement disorder specialist. So movement disorder specialist is someone that look after all abnormal movements. And there are different clinics around the country in different regions. It's important to be seen by a specialist more than a general neurologist, to be direct soon to the right pathway. Also to have more explanation, more support. Of course, if you are a female patient, you want to be seen by a female doctor, please ask and the GP can put these notes. The same for a male patient, if prefer to see a male doctor, is because it's important to feel completely comfortable, because in this consultation we discuss so many things, even very personal things. So it's very important to be completely relaxed and feeling completely not judged about whatever you want to discuss. If you need an interpreter, your GP can include this in the referral letter and the hospital will look after that. And always think that even something starts, because it happens, some people have a tremor, they don't want to go for the doctor, they are worried, or they started to see this hallucination, they are worried about this. So keep in mind there are many people in the hospital want to help you. Of course, sometimes we want to help even more, but we are very stretched. But there are doctors, nurses, therapists. So you are not alone if something or someone you know start. So there are people who look after you. We want to help you. Yeah. 2 more minutes. 12. Oh, yeah. 14, 12 more minutes. Okay. Many treats. So why it is important to go? We cannot cure yet, although there are some clinical trials, but there are many treatments available to improve the quality of life. And the diagnosis doesn't define the person. The person has still lots of things to do in the life. But if it is treated, because if someone is treated, although it's not cured, can have a good quality of life, enjoy the family, keep doing the job and things. So I listed few treatment here just to give you a general notice. So nowadays we have a clinical trials for idiopathic Parkinson disease, like the typical one that has been started in the country. There are some potential to make slow the disease. And then there are also therapy we started to improve the symptom. So when we call about making slower the progression, we call a neuroprotection, like medication that can protect the cells in the brain that are not died yet to keep alive and can make slow the progression. Levodopa is the typical that we use and has been around for years probably replace what is not produced in the brain. So in the brain is produced less the levodopa, and we gave from outside. It's like people with thyroid problem. They don't produce thyroid hormone and they take levothyroxine. It's kind of a similar concept. Then we have a medication that are slow release in the blood, so that we use overnight when people need. For example, if someone needs to wake up overnight to go to the bathroom and things, this medication help to keep people more mobile. Dopamine agonist is another list of medication, but it can give some side effects like impulsivity or other changes in behavior. So we try to start this in the young onset people because in the longer term they give less side effects. But on the other side, like what we call the abnormal movements that are one of the side effects of the levodopa. So we tried this to young people first. However, in some of them there can be impulsivity and then we need to stop. And these are a list of other drugs. I'm very happy if I will leave my email also if someone wants to ask more things, because we don't have enough time to go in details, but I wanted to give a wide knowledge of what we have. Then when develop some cognitive difficulties, we give some supportive therapy like cognitive therapy. We have a surgery to improve the tremor. As Aisha mentioned, one of my expertise is the brain stimulation, where the surgeon put some electrodes in the brain to stimulate the brain, but only some people are can be eligible for that. And then we have lots of other options. This just to show you that there are so many things can be done. Nowadays, we use also pump that is like under skin around the abdomen. They deliver for 24 hours the medication when people need. Postural hypotension is an important non-motor symptom, as I mentioned, because people can collapse. So we try or to reduce the dose of medication for Parkinson, or we start other medication to lift up the pressure. When people have psychotic symptoms like abnormal behavior or they have obsessive thoughts, we have a specific medication we can start to improve the sleep, to reduce the hallucination, and also to interact better socially, because these symptoms can be very disturbing. Non-pharmacological therapy, for example, speech therapy is very important when people start to have some speech difficulties. Psychotherapy, physiotherapy. Psychotherapy also for other family members, because it can be tough sometimes to accept the diagnosis, so some counseling can be very helpful. And functional surgery, as I said. MRI guided focus ultrasound is a relatively new treatment. In the NHS, we are commissioned in UK only for essential tremor and other type of tremor. Maybe we can speak about this another time. Happy to come back. And in Parkinson, we are not commissioned yet, but we have some funding for research to do this, where we don't put anything in the brain. It's just a laser creating a small lesion. Yeah, this helps mainly tremor. Yeah, this kind of therapy. This is the last slide. So what I want to show that wherever we come from, when this chronic condition comes, the reaction is the same. In every culture also, having something related with the brain can be very difficult to share. I can think about some small village around where I come from, so people really struggle to share this. But if you have the right doctor, the right nurses to open yourself, you can have all your support to be better and to enjoy your life, because Parkinson bring a lot of stuff, but also leave you with all the other things you can use for yourself. And also this picture, came from the title that Aisha gave to this meeting, because Aisha called Horizons of Hope. So I was thinking about several things related to Parkinson, specifically hope. I always say to the patients, keep your hope, because you can still do so many things. And horizons, because I think I like this, because especially nowadays, we really need to open ourselves more in medicine, in daily life, wherever we are. So I'm very happy. Being here today is really good for me. This is our team. We are a big team. The neuroradiologists are also very involved for scans and stuff. The surgeons, our secretaries, and the other consultant. And here in the last picture, I put my hometown, that is called Bari, in south of Italy, and Liverpool, where I live from, where I come from today. And thank you so much. I'm happy to have some question if we have. Do we have 5 minutes? Yeah.
Something called phymoquinone, which comes from flaxseed oil, supposed to reduce oxidative stress.
Yeah, there is. In Liverpool, we are activating one clinical trial. It's not with that medication. It's called 30 that act on the mitochondrial, some small part of the cells that we have. It's just been activated the last week. We completed all the paperwork, and it's for reducing the progression of the disease, but the criteria are very strict. So people needs to be assessed to be included. And then we are also including a big trial. It's called EGS ACT PD. This is a national trial in UK. EGJS ACT PD, ACT PD. It's a national trial where we are trying some medication that usually are being used for blood pressure, but in research I've used terazosin that have been used for blood pressure, but has been shown some impact on the progression of the Parkinson. So Liverpool is quite active with this. Liverpool, but also Manchester, other hospital in the region. You want to ask me?
I would just like to ask about, herbal remedies.
Yeah.
Plenty out there which can, this is reduced inflammation, like turmeric.
Yeah.
Also, like cognition improvement, brownie, lots and lots of them. But, how do you feel and think about the natural herbal remedies?
Yeah, I think herbal strategies are also quite important. For example, another big area of research is the connection between gut and brain, and some herbal agents are very good also to reduce the inflammation, as you said, and even for the gut, for the brain. So there is research also about, for example, today we don't have enough time, but there are lots of research about changing diet to change the progression.
Exercise before. So, one of the things is, when someone has a illness, family members can say, don't do anything, sit down, we will do
Yeah.
everything. Disease isn't it a condition that you need to move.
Yeah.
Help yourself, you need to keep moving.
Yeah. And also, this is correct. When I have in clinic also family members that are very worried and they keep saying this, I said, the person needs to carry on as much as possible the normal life. And exercise has been proved by research that more exercise people do, less severe.
Is that aerobic exercise?
Yeah, aerobic, but also, for example, Pilates and yoga for the posture, to keep the posture and the balance. Different type.
Kind of exercises where you're moving the legs.
Yes. Yeah.
Even
Yeah.
having to coordinate skipping.
Yeah.
Or hopping or.
Yeah, because the less you move, the more these symptoms become severe, as happened in pandemic when we saw so many patients being referred and they were doing okay because probably the symptoms were hidden by being active. And what I noticed, some patients that come that were like professional sportive people, or they were doing sports at high level, they really come and after many, many years of the symptoms that they didn't realize because they were doing quite well. Yeah. We do genetic tests, especially in people when the onset is the young onset, like before 55, because we know these young onset are the most common genetics.
55, 50, is that?
It's a kind of our cutoff. Yes, it's a kind of. Depends of the history, but I would say 50. 50, 55 is our cutoff to consider young onset, late onset. We usually do, yeah. It's not mandatory. But we think about different aspects. But yes, if there is a family history, like more people affected, of course, we put more attention on this. There is also a national study called the PD Frontline that cover all UK, where people with the diagnosis can take part.
There is no medication that stops Parkinson, isn't it? It's only prevention, right?
No, it's neither prevention, it's just for symptoms. And now there are two trials with medication to try to slow down or not to stop.
Just to slow down.
Yeah,
Nothing can
prevent stop now, not yet.
Is there a link with autoimmune disease as well to Parkinson's?
Yeah, there is lots of research about autoimmune and neurology condition in general, as because neuroinflammation or inflammation of the gut have been linked, but not definitive results yet. Yeah, it's nice.
So much.
I will come back. And if you need anything.
Yeah, she's got email there.